If I can just start the meeting by advising everybody that the meeting is being recorded, and the recording will be archived for future viewing. And if there's any technical issues, please can that be raised through the chat function. Thank you, Chair.
Thank you, Gareth. Welcome everyone to our Shared Regulatory Services Committee meeting today. If we can start on the agenda by taking any apologies for absence. Were there any, Gareth?
I think Councillor Mackie would like to say something, Chair.
Yes, Chair. I apologise that I'm going to have to leave at 11 o'clock. I'm on an interview panel.
That's fine, Norma. Thanks for letting us know. But there are no other apologies. So item 2 on the agenda is agreeing, and can I take these together, Gareth? The minutes of the 24th of September and our special meeting last week, in fact. No, the week before last.
Week before, yeah.
Are there any comments on those minutes? If we take the 24th first. No, so can I have someone to move that and a seconder, please? Councillor Lewis, I think you were muted, but I take it that you were...
Sorry, yes, I said I'm happy to move.
Thank you very much.
I'm more than happy to second.
And if we could take the minutes of the 3rd of December. Can I have a mover and seconder for those?
Happy to move again.
Oh, second.
There we are. Pick one.
Okay, you've got a choice there, Gareth. You can choose whoever you like to put in the minute.
Thank you, everybody. Thank you.
Yeah, thank you all. Next item on the agenda is to receive any declarations of interest. I don't think we've received any beforehand, so I take it there are none. Great. So if we move to the main part of our meeting then, it's you'll all be familiar with this sort of end of year report, giving us an overview report of our services and an update. So I think I'm going to Helen first of all to start this, and then I think you're doing you're passing on to other officers as well, Helen. So shall I pass over to you, Helen?
Lovely, thank you, Chair. And yes, it will be some teamwork going through this report. So if I can take members first to section 2, and this is some HR matters as we normally cover. Just very briefly to touch on sickness absence for Q2 of this financial year. And you'll see that while there's been no discernible change in the level of short-term sickness absence, which is good, we have seen an increase in compared to the previous year in long-term absence. And unfortunately, we have had a number of members of staff away on long-term sickness absence, and we're doing everything we can to support their return back into the workplace. At 2.4, an update for you on the journeys, as we promised, of our 2 regulatory services apprentices who were appointed or started work on the 1st of October. They're really getting up to speed now in shadowing officers and also managing their own developing workloads, which is great to see. And they've started their studies towards the level 4 diploma. At 2.5, a mention of another strand of our growing our own approach. And we've had some great success with 3 members of staff who have completed their MScs in environmental health. And all 3 have done exceptionally well, gaining distinctions. And I think that these two strands really provide reassurance through this growing our own approach, that we are building that resilience in the service so that we don't hopefully ever have to face the real challenges that we've had some years ago in recruitment and retention. And finally, in this section at 2.6, Another development, which members will be very, very familiar with, of course, is the appointment of the next head of shared regulatory services back on the 3rd of December. And a line there about the challenging recruitment process that was involved, which resulted in the Joint Committee making the appointment. And to reassure you once again that in the coming months, up until the end of March, the incoming and outgoing head of shared regulatory services will work closely together to ensure a smooth transition. So that's really what I wanted to cover in terms of some of those HR matters. Very happy to take any questions at that point, Chair.
Thank you, Helen. I mean, I just do have to comment on the apprenticeships and the MSCs, because, you know, in terms of, you know, we are going to talk about budgets later, but in terms of us having to find savings and so on, this is actually really good news part of our service, that we are, as you say, growing our own and supporting our own and nurturing, you know, progression in careers. And there is a career opportunity. So that, you know, that's, I feel very proud of that, and you should, you know, Helen, you should take that as because that, you know, that is part of your legacy that you will be leaving us with in terms of, you know, that growth. So thank you very much.
Thank you, Chair. It is great to see.
Norma.
I just wanted to congratulate the staff as well. I mean, as well as Helen, but you know, and the team for the work you've done. To get distinctions in an MSc is not easy, is it? And you know, they must have put a lot of work into that as well. And congratulations to them and everybody else who's helped them to get there. Well done, everybody.
Thank you. So, Helen.
Thank you, Chair. So at this point, we have the finance.
Yes,
piece.
Tyler, I think, is doing that.
Well, and I believe it is Tyler, yes.
Sorry, Chair, can I just interject there? I can see Councillor Lewis has got her hand raised. Can we just see if Councillor Lewis has something to say, please?
Oh, I apologise, Councillor Lewis.
Yeah, thanks, Chair. I just wanted to say to Helen, we saw the fight she had to start with the apprenticeships. We went through that, and to see it now come into fruition is a really, really good thing to see. And hopefully it'll just continue. And I'm just really pleased to see that's happening now. So well done to Helen for fighting.
Yeah, thank you, Councillor Lewis. Yes, I agree. Thanks, Helen. So, Tyler, I think, is taking the Appendix 1, the finance.
Yes, Chair, thanks. Can everyone hear me? I just wanted to just double check, just because I had the issues last time when I tried to deliver it, and I was a little bit quiet for everyone.
I can certainly hear you.
Yeah, all fine with
There we go. Sorry about that. It's the same on my end again. I thought I'd been lost again. Right, so I'll start with the overall position. So as at Q2, the overspend position has reduced slightly from the initially stated in Q1, down from 232,000 to 187k. The breakdown of which is split between an authority-specific overspend at the moment of 158k and then a £29,000 overspend within core. If I start then with the authority-specific areas, Bridgend and the Vale are both reporting small underspends at the moment, or forecasted overspends, I should say. So going on to Bridgend's, the 15,000 underspend that they are reporting is mainly consisting of a forecasted underspend of 22,000 within the licensing team, and then a few smaller variances then within the other aspects, coming to that net position then of the 15,000 underspent. Cardiff's overspend position has reduced from the Q1 reported figure and is currently reflected at 176,000 for the year. As is historically known, that predominantly relates to the forecasted overspend, about 190k within the licensing section, which obviously we know is the difference between the historic difference between the budgeted figures within that. The HMO teams then have reduced slightly, and they are forecasted to be 3k overspent for this financial year. The only thing to draw reference to within the Cardiff Authority specific services is the student liaison side of things. That is the biggest driver in relation to the reduction in the forecasted overspend within the Cardiff Authority specific services. And that is because there is some additional funding which has been made available since last year, the SPF funding. I've been liaising with the team lead within that, and at the moment there is quite a large amount of that funding which isn't being utilised in year, which is sort of driving this. I believe at the moment it's about £29,000 forecasted to be underspent because of that additional funding. So that situation may change because they are potentially looking to develop some additional schemes which will utilise that that government funding. So that position is the only one really which is sort of subject to change at the moment. And then moving on to the Vales position, very little has changed within the Vales position compared to Q1. The net position of licensing and burials is coming out as a net spend, the net balance spend, sorry, with them being 5k underspent and overspent respectively. Pest control it's close to reporting to on budget with a small overspend of 6k. And then kenneling and vets are forecasting a 9k underspend, which is consistent to what we've seen in previous years. Pardon me. And then moving on to the core element, the overspend again, similarly to authority specific services, has reduced slightly. The forecasted position as at Q2 is a 29k overspent. There is a £21,000 underspend within animal services, and similarly an overspend of 50k within environmental services. And both of those, there doesn't really seem to be sort of a main driving factor. It's sort of a number of variances within different costs that have occurred within the year. But there isn't really anything specific to highlight as to why those positions are as they are. The food services team is forecasted to be £69,000 underspent, and that is mainly due to a vacancy over the summer, as well as a reduction in the use of some of the external contractors which the service has previously used. Housing services is forecasted at £43,000 overspend, and that is mainly due to additional salary expenditure and staffing need for the service because of the service demand. And then the health and safety and communicable disease is forecasted to be 30k overspent across both teams this year. Again, similarly to the animal services and environmental services teams, these are smaller variances. Pollution services is in a similar, again, it's a 17k overspent at the moment. And then finally, it is the trading standards team, which is also forecasted to be overspent by roughly 45k for this financial year. Is there any questions on any of that?
Thanks, Tyler. Are there any questions from members? Helen, did you want to come back on any of those? I've got a bit of feedback, Gareth.
Yeah, maybe some of your end, Chair. Sorry, I'm not getting any feedback my end, but I don't know. Headphones, Chair.
I'm not using headphones. You're suggesting I should use them.
Unless someone's got unless someone's not muted their microphone, Chair, and we can hear it through the system. I can hear my voice after I speak, but I'm not sure if that's coming through your computer or Tyler.
Yeah, exactly. I can hear your voice, but I can't hear my voice now. So I'm not having feedback for myself. Anyway, we'll continue. So I just wondered if Helen wanted to comment on any of that. And Tyler, did you want to come back in?
Nothing further from me, Chair.
Thanks, Helen. So if there aren't any questions, thanks, Tyler, for that.
Thanks, Chair. Okay, thank you. Now.
So next part of the report, I think that's Christina and Will.
Morning,
Christina,
everybody.
hello, hi.
Hi. So I am also experiencing some IT difficulties this morning in that everybody on my screen is frozen. So my apologies in advance if I freeze in a very unattractive position, but I'm hoping you can all see me and hear me okay in any case. But please do shout.
You're absolutely fine, Christina. So I apologise.
Lovely, thank you. I'll carry on regardless then, Chair. And in relation to my bit today and this section, members can refer to the a very colourful document in relation to performance. So I'll whiz through this for you. So the first page for me relates to the high risk food and hygiene inspections, which relate to category A and B inspections, and you'll see that we are reporting in as a green, so all good in that area. The next page relates to category C food hygiene inspections. Again, you'll be aware that these are inspections that take place once every 18 months. And there is an amber reflecting on that page, which relates to the Cardiff area. And the narrative provided there talks about 5 inspections that weren't completed in the time frame. So to give some confidence, those inspections have been completed where possible, and they relate to access type issues, which we do experience sometimes in the food world, in that some premises are not always available for inspection if they carry out activities at certain times and so on. The next PI for us is our new business PI, and we are reporting some reds there. Now, members will recall that at our last meeting, I advised that we had some delays in onboarding some of our contractors. And of course, that was just reflected in the budget update that Tyler has just given. We are onboarding them now, but of course, that's a delay then in terms of some of the inspections carried out. So the officers have been told to concentrate on the C-rated inspections, but that's why we are seeing some reds in relation to new businesses. But I am anticipating, members, that we will be caught up and all back to normal come the end of the financial year. You'll see the next page relates to broadly compliant and very good figures of compliance out there. Obviously, we do find some premises that are non-compliant, and relevant enforcement work takes place in relation to those. But as a benchmark in terms of the standards that we have in our area, that is a very good level of compliance. The next one for me is the high-risk trading standards inspections, and there is one amber there in front of you. And my apologies, members, that is a miscoding of an inspection that's been put onto the system. So the true picture is actually that they should all be green, in that they were all completed in time. That officer unfortunately just put the wrong code on, which has appeared as an amber on that one. The next one is a new business trading standards PI. Like the food hygiene PI, as you know, in terms of food standards, one drives the other. So as one is reporting as red, this is influencing the other. Again, we have picked up after this report that was done that this situation does look slightly better than what we're reporting, in that there was some errors in terms of input into that, but that has been rectified and will be reflected in the next quarter's performance, which we report to you. Now, if I may, I'm just going to carry on in terms of MEES, and then I will hand to you. And the MEES work, which is another one that sits with me, which is presented on page number 13. You'll recall that we have been dealing with MEES work a batch at a time, and really looking at identifying non-compliances and then dealing with them, obviously encouraging compliance where necessary. But we're just coming to the end of the first batch of those non-compliant premises. We have managed to achieve compliance in terms of some, but we have had to issue some compliance notices to those who we weren't able to get to comply. And that relates to 1 compliance notice which remains outstanding in Bridgend, and 2 in the Vale of Glamorgan. But that piece of work when we started was looking at over 200 non-compliances, and we've got that down to 3 where we're just having to issue compliance notices to try and achieve compliance in that way. So the rest of the performance relates to Will. So Will, if I may, I'd like to hand to you, and perhaps we could take some questions at the end.
Yes, thanks, Chris.
Christina. Over to you, Will.
Yeah, thanks, Chair. Good morning. So very briefly, I thought I'd just report on any exceptions. The licensing returns are all green, and we've complied with the legislation there. Pleased to report that response times for domestic noise complaints were exceeded. And for the commercial complaints, overall we had an amber, but that was just slightly under the target of the challenging 1-day response. And then for our response to car alarms and sort of public nuisances, we were again exceeded our target. So generally nothing else to report from my side. Happy to take any queries from members with Christina.
Thanks, Will. I think actually, as you both went through it, you explained lots of the questions that may have arisen on some of those. But do members have any specific questions to either Christina or Will? I think you've got away with it here, guys. So,
Okay. I think Christina is going to take back
yes,
us back to the main report now. Okay, thanks.
Thank you,
Thanks,
Chair.
Christina.
So I'm at paragraph 2.10, which relates to the Port Health Plan. And this is our final plan of the year of the suite of plans that we bring. You've already had the Food Law Enforcement Service Plan, as well as the Section 18 Health and Safety Plan and the Communicable Disease one. So this will be it from me, from my perspective for this year in any case. And I'm not proposing, Chair, to go through this in any level of detail other than to advise the Port Health Plan is something that we produce on an annual basis. It details our statutory responsibilities in terms of monitoring the safety of imported food and feed at the point of import. It's all about protecting our borders. Of course, you know the importance of that. And of course, looking at the conditions on board vessels when they come in, looking at the ship sanitation and the standards for the crew on board. So, as I said, I'm not proposing to go through that in any level of detail. It's there for information purposes only. And of course, happy to take any questions should you have any. I believe you're with me again for the next page, which relates to smoke-free compliance, which is a 2.12, and that will be the final bit in terms of my update. So this relates to smoking in hospital grounds, and members will recall I have mentioned this to you previously. So the legislation applicable here are the Smoke-Free Premises Wales regulations, and in 2021 the requirements in terms of those regulations were extended to look at smoking in hospital grounds. Now, SRS, Environmental Health Trading Standards Departments, we're the regulator for that piece of work. But we're also the regulator for the health boards, if you like, as well. So, as you know, we try and work in partnership as best we can. And we've started with an audit of our Cardiff and Vale and CTM sites, really looking at compliance in terms of signage and extra support and so on. And we've provided a documentary evidence to the health boards in relation to compliance and where improvements can be made. And we have moved on in Cardiff and Vale in relation to this piece of work, in that we are currently undertaking an educational initiative where we have an enforcement officer patrolling the sites of Cardiff and Vale, very much education, trying to achieve compliance through negotiation and advising people of the law at the moment. with the view in the new financial year to look at the service of fixed penalty notices if we're ready and in a position to do so. So part of the patrols is obviously to provide advice in relation to smoking cessation as well, but doing this in a very sensitive manner. Of course, we're mindful of people visiting hospital grounds, and they may have received some bad news, that may have been having some medical care, but of course all gearing up that eventually we will be issuing fixed penalty notices. So I'm hoping that this is a piece of work that we will move out to other regions, particularly the CTM regions, and of course we will come back to Joint Committee with some more details in terms of how that initiative is going, but for information purposes for now. Thank you, Chair, and happy to take any questions.
Thanks, Christina. Yes, and that will be kind of rolling that out to other areas would be obviously very good for us, but also going forward, actually, to see the compliance will be fairly interesting, because I think when you go to somewhere like the Heath, I think that entry when you enter the Heath immediately, it is full of smokers, which is very off-putting, I guess, when you go into a hospital. I don't know if there are any other questions. Councillor Drake, I think, first.
Yeah, I was just going to say, as an asthmatic, trying to walk through these areas where people are smoking, it's a nightmare, really, really nightmare. Yeah, and I hope that people will get on board with it and decide, no, I shouldn't smoke outside a hospital. It's damaging to people's health. So be it.
Absolutely, Councillor, and thinking about some of the sections, the maternity units and so on in hospital grounds is absolutely inappropriate, isn't it, for people to be smoking outside? So we are trying to work with the health boards as much as possible. People seeing other people smoke creates an impression, of course, that that's acceptable. So we need to be mindful that people are very aware that the law is no smoking in hospital grounds. So yes, looking forward to seeing what compliance levels we have in the new year.
And it's quite extraordinary, actually, that hasn't happened before, in my view. But yes, anyway, Councillor Mackie.
Yeah, just the same, really. I mean, it'd be really interesting to see how it works, because, having been a nurse and worked in hospitals, people who do smoke find various ways of managing to have a cigarette. And sometimes it's even sort of in the loos and on the ward. So outside, when they go out for a breath of fresh air, most of them go out to have a cigarette. And so how it's going to be managed, and I'd be interested to see it, on compliance rates, because some people will try and find some way of doing it, and I hope it won't be going into sort of some outbuilding in the hospital that they manage to find they can get into. Good luck.
Indeed, yes, thank you, Councillor. But of course, in terms of patients, they are offered smoking cessation tools whilst they are in. So again, it's about encouraging people to take up those aspects should they need them, in terms of a support mechanism for them also. But you're right, people are very keen to go and have a cigarette. So having an enforcement officer really patrolling and getting to know those areas that they could hide away is important. So all intelligence gathering at the moment, but I will keep you posted.
Great.
Thanks, Christina. So I think the next part's back to you, Will.
Yes, thank you, Chair. So this part of the report is a brief update to members on an area of work in the SRS which they may not be familiar with, which is public health funerals. So in paragraph 2.15, it details the duties placed on councils under the Act to bury or cremate those for which suitable arrangements have been made. And there's been some guidance published for local authorities to make sure that they do that in a responsible way. So section 2.16 details the reasons why public health funerals are arranged. And it typically revolves around either no next of kin being available, or unfortunately families not being able to afford the cost of a funeral. The FRS discharge this duty for the Vale and Bridgend councils. Within Cardiff, there's a separate bereavement services team within the council that undertake this piece of work. So, as you might imagine, the work involved in this is quite specialised, and for that reason, it falls to a relatively small number of staff who've developed an experience with the legislation and an expertise to do the work over the years. So the report details the types of activities that they undertake, but it involves liaising with the coroner's office, dealing with the funeral directors, trying to trace next of kin, and ensuring all the sort of relevant documentation is completed and registered. There is a cost to this service to the councils involved. The average cost of a cremation is around £1,500, although it does vary between the two authorities. There is a facility as well for us to try and reclaim that from the estate if it is available, and there's some legislation in place which gives councils a priority when they've undertaken a public health funeral to try and recover those costs. I think the key takeaway, and one of the reasons for bringing this to the joint committee is that the demand for public health funerals is increasing, unfortunately. That's driven by factors such as social isolation and financial hardship. And this is very much a UK trend. There have been some articles in the media recently as well around the rise in public health funerals, and across England and Wales, it is falling on local authorities more and more to undertake these funerals where either the family can't be traced or there isn't the funds available to do it. Now, as the final paragraph 2.2 identifies, we are likely to exceed last year's total of 20 funerals this year. And apart from the demand on resources, there is a demand on staff time. The workload is significant, even though there are relatively small numbers involved. It does take a lot of time for officers to arrange these funerals, and some of the work can be quite distressing and take an emotional toll on those involved. So our thanks do go out to those, as I said, relatively small numbers of staff involved, and as we proceed over the following years, we'll report back on numbers of funerals and whether that trend increases. So that was a very brief synopsis of the work we do in that area. Happy to take any questions that members may have.
Thanks, Phil. I have a quick question. So in terms of the number of funerals, because we've got there's a considerable increase from a year, the year 20 through the whole year, and 17 just in the last 8 months.
Yeah.
And I hear what you say about the the cost of living and people being in isolation. But do we, when we as an authority arrange these funerals, is there somewhere to put that data around reasons for having to do it? Because it kind of then builds a picture, doesn't it, for us in the Vale as well?
Yeah,
is there some way of capturing that data?
Definitely, we log all our actions on our database, and there is a separate portion of the database that records public health funerals, which is how we're able to report. And within that framework, we'll also have information on how we became involved. So if you take the Vale, for instance, there's hospice. Quite a few of our cases come via the hospice. We normally get contacted by the coroner's office. So all of those details are available, and it is something that we can track, yes.
Yeah. Okay, good. Are there any other questions? Thanks, Will, for that.
No,
I think the
thanks.
next part of the performance report is from Jason.
Yeah, hi, thanks, Chair. Can I just check people can hear me, because I am having some difficulties with the internet. So I'm sure you can hear and see me.
No problem.
I can hear you and see you. Yeah.
Right. Okay, that's fine. I just wanted to make sure, because I was like Christina, my screen is freezing when people are speaking. So, yeah, thank you, Chair. As we said, we're looking at supporting the local economy. I'll take members through some of the work we do with businesses from 2.1 through to 2.29, really. And if members can remember at our last meeting in September, we brought information on two significant prosecution cases around food safety and food fraud. And given those cases, obviously we did have to take formal enforcement action because it was proportionate and in line with our enforcement policy. But obviously we do like, our preference always is to try and work to achieve compliance in a positive way, and we do that through advising and supporting businesses to operate in correct ways, not only for the benefit of the business themselves, but also for the customers and the wider economy, really. But working with those businesses, obviously this sometimes goes unseen and isn't always that visible part of the work that SRS does. But obviously the provision of that timely advice and guidance can help improve businesses' practices, resulting in compliance with regulatory law, and enhances the economic viability of those businesses. So over the last 10 years, since the formation of SRS, we've always positioned ourselves at that forefront, where we try to work with that business engagement through the range of the services that we can provide. And obviously in this context, we've achieved a great success over the years, and we can continue to do that. And we try and work in innovative and other ways with businesses, both within the region, but also nationally. And that allows businesses to focus on their growth and development. And this obviously clearly aligns with the vision of our three partners, really, in supporting that local economy, and reflects more wider principles around the regulator's code. In September this year, we took a different view on this, and we did a different advice to businesses when we attended a business advice surgery that was run by the Vale of Glamorgan Council. Within this, officers from our industry team were able to attend and speak to local businesses, where we were able to give them advice on matters such as food hygiene, allergen safety, and food labelling requirements. And you can see there with paragraph 2.25, our officers there attending that event with a local business. And this was really successful. Businesses gave us really positive feedback on this session, and found obviously the advice we gave to businesses to be really useful. So again, we're going to be looking to try and see if we can work with colleagues in Bridgend and Cardiff to run similar events, and obviously try and repeat such an event in the Vale as well. Moving to 2.26, just giving members again a further update on the training that we provide. As members will be aware, we do provide a number of training courses, and we cover a wide range of areas around regulatory matters such as food safety and food hygiene, allergens, health and safety, the prevention of underage sales, and the infection and prevention and control and special procedures. And that course was very important, really, because obviously under the special procedures regulations, that level 2 award was required for anyone applying to become a licensed practitioner. So again, really helping businesses to meet new regulations and provide that training to them. Paragraph 2.27 just gives some information on some training we've done through our primary authority with the two local health boards, Cwmtaf and Cardiff and Vale. So we provided direct food hygiene training to the staff who provide the catering at the hospitals. And this is really important because we were able to tailor that training to meet those particular needs in the healthcare settings, and obviously ensuring that the food hygiene levels at these premises are of the highest standard to ensure that we are protecting those vulnerable patients. And we've also been undertaking other training for other local authorities around allergens, and we've done training with Newport and Monmouthshire, and we do charge for those services to those other local authorities. And the final paragraph there, 2.29, just some developments where we're looking to get our own learning management system, which will help us deliver some further training online, but also more importantly, help us with the improvements of the administration to improve and enhance the training services provided. So I'll pause there if members got any questions on that support that we do give to local businesses, whether that's through business advice or any training courses.
Thank you, Jason. Do members have any specific questions on that section for Jason?
I can't see the hands up, so I'll continue, Jeff, that's okay.
Thanks.
So moving next to paragraphs 2.3, and again, just advising members of some success for our animal health team and our animal warden services. Every year, so the RSPCA does what they call the Paw Print Awards, and this looks to recognise exceptional contributions and commitment to protecting and promoting animal welfare. SRS again has been recognised in 3 categories again this year, that being for the stray dog provision, our animal-related licensing activities, and the kennelling services that we provide. And really pleased to advise members that this year we've achieved the Platinum Award, which is the highest standard across those awards in all 3 of those categories. And again, it just demonstrates the hard work and commitment of both our animal wardens and animal health and welfare officers. And I just really want to thank all those officers and the team manager, Rebecca Arthey, for the work that they do in some challenging circumstances when they're out and about doing inspections. And again, this obviously is recognising the Platinum Awards, shows that we've had a gold standard in each of those 3 awards for over the last 5 years. So it just shows that consistency of the level of awards that we're able to achieve and the excellent work that that team provides, really. Moving to 2.32 to 2.37, which is the last area I'm just giving an update on, is unfortunately the spread of avian flu across the UK and particularly our area. So members may be aware that on the 13th of November, Welsh Government announced that there is a mandatory housing requirement to prevent the spread of avian flu and trying to restrict the spread of it. So that requires any keepers of over 50 birds of any species that they have to be housed. That applies to also the flocks of less than 50 birds of any species if those are eggs or poultry products are sold or given away. And that also then requires enhanced biosecurity measures to be undertaken as well. And there's information there in 2.33 of what those additional biosecurity measures should be. Paragraphs 2.34 and 2.35 is giving members an update. Obviously, we are getting reports of avian flu and wild bird populations that had confirmed results from the Animal Plant and Health Agency, both in the Vale of Glamorgan and within Cardiff, that there is avian flu identified in those wild bird populations. Unfortunately, it does spread in wild bird populations. That's how it is spreading across really the region. Really, the sight of ill or dying birds obviously can be visible and it can be distressing to members of the public. But I think our main sort of advice here is obviously that concern is there. The spread or the risk of avian flu being transmitted to humans is low. And the advice we've been giving through our social media channels is obviously if anyone is seeing or finding dead wild birds, it's not to touch them, not to handle them, to avoid feeding wild birds. And if they do see any sick or dead birds, that they do report that, and information is given there in 2.35. And that is, there's an online portal to report directly to APA or the telephone number there, which is available as well. And members of the public would have to give their information and the location of where those birds have been spotted. I can pause there on as well if there's any questions that members may have either on the awards from the RSPCA or on the avian flu information. I can see Councillor Mackey, you've raised your hand.
Yeah, just to echo your thanks to the staff and to yourself as well for all the work you're doing in the animal welfare. You know, I mean, excellent work going on there, and thank you very much, everybody, for that. On the avian flu, is the flu seasonal as it is with humans? Because I mean, we tend to get flu more in the winter. And is that the same with the birds?
Yeah, it tends to be. It's actually probably started a little bit earlier than this year. We normally sort of start seeing it towards the end of December into January. We started getting sort of initial potential reports through towards the end of November, mid-November to end of November, councillor. So yeah, it's a little bit earlier this year, and yeah, it will potentially go through the course of the winter, just depending how it is spread across, the bird populations. Really, unfortunately, there is no vaccine for avian flu. So yeah, unfortunately, it does, once it starts getting into the population, as the flu in humans does, it does transmit. But thankfully, there is that low transmission into humans, and that public health risk remains relatively low. But obviously, in terms of the wildlife, there is that risk, unfortunately.
Mm-hmm. Oh, thanks, Jason.
Jason, just firstly, also just to reiterate, Councillor Mackey's congratulations to the team on the awards. So again, you mentioned that we've advised, we have general advice available for people that keep birds, if there are people that do that. But so my question to you is: are there, in the Vale, for example, or in the other authority areas, are there? What are the numbers? Do we know of people having birds, keeping birds?
Yeah, we do have records of those keepers, Chair. We're quite fortunate, I suppose. We don't have any of the sort of large sort of poultry premises that other sort of local authorities have, really. So from that perspective, the impacts into our teams is quite low. But yeah, we would know of those who are sort of who are selling eggs or poultry products. So we do have that information available, and we've been sort of putting information out through our social media channels of the information that those keepers should be following in terms of the government compliance there.
And that telephone number for reporting, where does that telephone number go to then? Who's collecting that information?
So the number, which is 0345 5933 5577, that is the Animal Plant Health and Agency, who take reports of the dead birds. So what they will do, if it hasn't been detected in an area before, they will come out, take the birds away, sample them to be able to confirm if the bird has died of avian flu. Once we get a confirmation that avian flu is confirmed within an area, in the wild bird population, this is, they won't come out to test further, usually within about a 3-kilometre radius. So once it is detected locally, when birds are dying, particularly in the wild bird populations, it is just then assumed, it's most likely from the results of avian flu.
Okay. I think we've got 2 more questions actually now. Councillor Drake first.
Yes, Jason, this might be a naive question. Does avian flu affect all birds? All types of birds? Because the reason why I'm asking, they found a dead swan the other day down in the Knapp, on the side of the Knapp pool, and I was the lake, and I was wondering whether does it affect those type of very large birds as well?
Yes, it is. So it is particularly vulnerable, those wild sort of larger birds of swans, geese, ducks, really those larger birds. So that bird that was found in the Knapp, that's one of the test positive results we've had back this week, Councillor, that has tested positive for avian flu. So we've updated our messaging to confirm that and providing that additional advice then for members of the public not to help those sick birds, not to pick up the dead birds, really, because we're trying to reduce that transmission of the disease, really. So
yeah, it was very sad to see that.
Yeah, it is quite sad.
I love watching swans and everything, Yeah, thank you.
Yeah.
Councillor Lewis.
Thank you, Chair. Jason, we have a very large chicken farm in Bridgend Borough. Has there been any instances there?
No, so again, we would be that would be led by APFA. So if there's been any testing of that premise, they will be letting us know. They would lead on any of the requirements. We would support that in terms of any sort of restriction zones being enforced on that. But we would be in touch with APFA, and we would be notified immediately if there was concerns of that poultry farm.
Okay, thank you very much.
Right, Jason. So we're going back to you.
Yeah, I think just one last section, and for me, and I'll be passing you back to Helen then. So just giving members an update on work we undertook as part of National Safeguarding Week. So that took place between the 10th and 14th of November. So again, officers from our safeguarding team run a series of road trader days across each of the 3 local areas. And this just gives an opportunity for officers, we can speak directly to traders, offer them advice and guidance to ensure that they are fully compliant with the consumer protection laws. And it's usually particularly useful. We get a chance to speak particularly to some new traders who are just, coming into the practice, and we're able to give them that advice, some advice packs and that direct advice on consumer law. We undertake this work in partnership. So South Wales Police joined us on these days, and they pulled over a number of vehicles and checked some of those, and actually seized one of the vehicles for failing to have a valid MOT certificate. But we also then do some additional proactive work with this, as detailed in paragraph 2.37, where the officers will do some training. So we did some direct training with patient care team members, and again, just raising that awareness on doorstep crime issues. And we've had additional, on the back of the Safeguarding Week, we've had some additional groups come forward, particularly Age Friendly Cardiff, to do some future training on that. And again, the team are always available and willing, so any community groups or anyone who wants training around doorstep crime issues and other safeguarding measures, the team are always willing to work in a proactive way and are available to undertake training. So I'll pause there, and if there's any questions, again, happy to answer those. If not, I'll be passing you back to Helen, I believe.
Thanks, Jason. I don't think there are any specific questions on that. So thank you very much. And over to you, Helen, for the last bit of this report.
Thank you, Chair. Just to conclude the report at 2.38, the Association of Chief Trading Standards Officers Impacts and Outcomes Framework has reported again recently, and this is an item that we regularly bring to Joint Committee. And just very briefly for this meeting to say that the England and Wales report has been published, and really the takeaway for me is the fact that the combined effort, if you like, of trading standards across England and Wales has resulted in almost £2.6 billion of consumer and business detriment being tackled. And that means that over the course of that last financial year, the Trading Standards Services demonstrated their worth by saving £7.72 in the economy for every £1 spent. Now, we don't have the Wales only data at the moment, but you may remember that last year we brought the Wales data under this impacts and outcomes heading back to Joint Committee for the March meeting. I propose that we do that again because it was very interesting to see the impact of Trading Standards Services in Wales, which were even better value than when compared to the England and Wales total that we've just looked at there. So again, for information for members, and the full report is in Appendix 4. 2.41 is just to mention, as we always do, that details of recently concluded prosecution cases are included in Appendix 5 to the report. Only 8 concluded in the period up to the end of November from when we reported last. It doesn't sound a great number in terms of quantity, but the sheer amount of work that has gone into those, and of course, there's a time lag while these things come through the court process. So very, very briefly, reflecting the full range of SRS functions, successful prosecutions in respect of smoke-free law, private sector housing, late night street trading, health and safety at work, food hygiene, illegal money lending, fireworks safety, and a rogue driveway installer, which was a particularly nasty one, with threats to the victims of that particular rogue trader. So all that information is in Appendix 5. Of course, I'm happy to take any questions, Chair, or otherwise I will take you to the recommendation for the report.
Are there any questions from members on that last bit of the report? No? So I think we can move to the recommendations, Helen.
Thanks, Chair. So the recommendations for this report are number 1, to consider note and agree the contents of the report. Number 2, to approve the 2025-26 Port Health Plan. And number 3, to authorise the head of Shared Regulatory Services to make administrative amendments to the Port Health Plan 25-26 should the need arise.
Thank you, Helen. So I'd like to move those recommendations. So can I have a seconder? Councillor Drake, happy to second.
I'll second that. Yeah.
Thank
Thank you
you.
very much for all this work. Yeah.
So those recommendations are moved. So the next item on the agenda are SRS fees and charges. So is that back to you, agenda item 5, Helen? Are you covering this?
It is me again, Chair, and this paper and the attached annex will be familiar to members. It follows a very similar format to what we bring to Joint Committee each December. So you will see that the annex to this report is set out, as we always do, in 2 parts. Part 1 of the annex contains those fees and charges which the Joint Committee consider and agree each year. And then part 2 is given for completeness. Part 2 contains those other fees and charges which are set externally. So that might be by UK government, by Welsh government, or other agencies, for example, the Association of Port Health Authorities in the case of port health fees. So each year, when we bring this report, we use a consistent methodology and we apply the CPIH rate of inflation for the previous August. So we're talking now about the CPIH rate of inflation for August 2025, which stood at 4.1%. So all the fees and charges within the control of the Joint Committee in Part 1 have had the 4.1 increase applied with 2 exceptions. So the first exception that I will mention is our hourly rate. And the increase in the hourly rate that is proposed is a £5 increase, and that works out at nearer 6%. But that is very much keeping us in line with other local authorities who successfully charge for work. So it's suggested that the new hourly rate will be £90, which is a slightly higher percentage increase. The other set of fees, which hasn't had that 4.1% increase applied, you'll find on page 7 of the fees and charges annex. And you remember for the first time last year, we brought the fees and charges for the special procedures regime to you. So those fees and charges have stood still, if you like, because of that agreement across Wales, which Welsh Government was very keen to see, that there was a consistent approach and consistent fees across Wales. We are finding out at the moment if there is an intention to increase those for the 26-27 financial year. For the time being, I've left them as they are, and it may be the case that we need to bring that element of the report back to you in March if there is an increase across Wales proposed. So hopefully that will be okay with members. The only other thing to mention is that we've taken the opportunity to simplify the fees and charges structure for pest control services. So the rate of increase proposed is in line with that 4.1%, but the table looks a little bit different because we've simplified it. So that in a nutshell, Chair, is what we're bringing to you today with the fees and charges report. And the recommendation is that the Joint Committee is asked to consider the SRS charging and fee proposals as set out in Part 1 to the annex of this report and agree to their implementation from the 1st of April 2026.
Thanks, Helen. So I think that was a kind of a good housekeeping report in terms of just keeping us updated. So I don't think there are any questions on that. So I'm very happy to to move that recommendation. If I can have a seconder, please.
I'll second
Councillor
that,
Drake.
Chair.
Thank you, Councillor Drake. So that recommendation is moved. So now to the next item on the agenda, which is our budget savings. And I think Gemma is taking this.
This is with me, Chair.
Part one, yes.
Part one, and then obviously we were
We'll
going
move
to
part two, yeah.
Yeah. So if I can take members to the part one paper on regulatory services budget savings for 26-27. This is a very brief paper, and again it goes over some familiar ground for you. So if I can take you to section 1 of the report, which is background, and this is some information that we share with you each year. I won't go through it in detail. Suffice to say that in that early part of this paper, we're setting out where the service has come from, the drivers for that, one of them obviously being to realise cost savings, building resilience, and enabling specialisms to be retained. And then from 1.2, we talk about what the budget, the combined budget of the three standalone services was back in 2013-2014 when Atkins put together their report and recommendations. And then the subsequent sections talk you through some of the changes or the savings that have been realised since the service went live in 2015. So those savings have been delivered over the years, and I'll take you to 1.5 just to say that as a result of those savings, since 2018 alone, those savings have amounted to nearly £1.5 million, and that includes £636,000 in immediate budget savings, which were delivered, you'll recall, across the 23-24, 24-25 and this current financial year. So in 1.6, again, a statistic that you'll be familiar with, but it is perhaps an even more impressive statistic now, because we're 12 years on from that baseline of the three standalone authority budgets, and our statutory services have been delivered for 14% less budget and by 33% less staff. And of course, over that time, the service has taken on new legislation and areas of regulation. So as a result of the challenging financial outlook going into the new financial year 26-27, the partner authorities now require a consideration of options for further savings to be made by the service, and options have been requested for achieving a range of savings from the core services budget, which is of course the responsibility of the Joint Committee. So it's a very brief run through the background, Chair, and then the recommendation for this Part 1 report is for the Joint Committee to note the content of this report with a view to decisions being made on the Shared Regulatory Services Budget Savings Report, which will be introduced under Part 2 of the meeting agenda.
Thank you, Helen. And just to remind members that we are going into Part 2 to consider the budget savings in more detail. So this, Helen, as she quite rightly said, this is this report in Part 1 it really gives an overview of the background to the budget savings that we'll consider in a bit more detail in Part 2. So I unless there are any specific questions to Helen now, I'm happy to move those recommendations in this report. If I could have a seconder.
I'll second that, Chair.
Thank you, Councillor Drake. So that recommendation is moved. So it's now for us to move to Part 2. of the agenda. So, Gareth, can I just check that we're...
Yeah, can we just need a formal resolution to go to part 2, Chair? So we can just have that moved and seconded, and then once that's agreed,
Yes,
Chair.
sorry, Gareth. So I'd like to move that we move to part 2 now in the agenda. So can I have a seconder for that?
I'll second that, Chair.
Thank you, Councillor Drake.
Okay, thank you. Yeah, Chair, we'll just make arrangements to move to part 2. Just bear with me 1 second.
Great.